So this video is an inferior glide of the hip joint. So this glide we can use for pain modulation, as well as increase general range of motion, including helping symptoms of hip impingement. So for this one, simply, what we're going to end up doing is taking the patient's leg on the affected side, bringing it into a 90-90 position, and then we're going to be creating an inferior force with our hands. To do this, a lot of times what I like to do is rest their leg against my shoulder, and then bringing my hands as close to the joint as I can on the femur. And I'm just going to pull inferiorly. So first, like with every joint mode, you just want to start by feeling how much joint play they have. So go all the way to the end, and then we're going to apply our grades. So grades 1 and 2, just looking for little glides, not completely to end range, and this is helping with pain. Then we can go to grade 3, where we're mobilizing and oscillating at that end range to mid-range motion to help try to increase motion. So again, just a simple inferior glide. I'm getting as close to the joint as I can, and I'm pulling down.